The healing process following tooth extraction is as follows. The first 2 days following surgery are the most uncomfortable days and edema usually occurs. The third day is a little more comfortable. Eating becomes easier even if the swelling continues. In the remaining days, recovery progresses rapidly. After the extraction, firmly bite the cotton or gauze pad placed on the extraction site by the physician for 20 to 25 minutes. This tampon stops bleeding in the extraction space and ensures the formation of a blood clot, which will ensure a healthy healing. If you change the tampon frequently, you will prevent clots from forming. The clot will close the extraction space like a natural buffer and make the necessary preparations for the space to be filled with bone structure in the future. If the clot is broken without care, wound healing will be impaired. The surgical site should not be touched and the mouth should not be rinsed on the first day. Rest for a while after tooth extraction. If possible, lie down with your head elevated. If there is pain after the extraction, you should take a painkiller other than aspirin. Aspirin, due to its blood-thinning properties, can initiate bleeding and prevent clotting. As the numbness begins to wear off, there may be severe pain. In this case, painkillers should be taken immediately. There may be pain in the injection sites used for anesthesia in the days following the extraction. These pains usually pass within 2 days. Slight bleeding in the form of leakage is normal for up to 24 hours after the extraction. If there is heavy bleeding after the extraction, bite a clean, sterile cotton pad for half an hour. If the bleeding does not stop and continues with the same intensity, consult your dentist. Do not smoke or drink alcohol for 24 hours after tooth extraction. Do not consume very hot or cold foods, because this may cause the clot to break away and bleeding to start again. In the first days, it is recommended to stay away from grainy foods so that they do not escape to the extraction site and to eat liquid foods whenever possible. You can also switch to solid foods after a few days. Very hot, cold and acidic foods should be avoided. Warm and soft things should be eaten and drunk after tooth extraction. If the tooth extraction took place under difficult conditions and for a long time, it would be beneficial to apply cold externally every 5 to 10 minutes every hour for 8 hours. This way you can control swelling and bruising. The extraction site should not be touched in any way, and the injured area should not be used for 24 hours. After the extraction, do not touch the extraction site with your tongue or any other tool, and do not disrupt wound healing. Since the tooth is inside the bone, patients try to remove and detect the bone that appears after extraction, mistaking it for a root. If there is a root left, your doctor will warn you anyway. To be sure, you can see your decayed tooth after extraction. The extraction site must be kept clean. Food residue filling into the wound should be prevented. 24 hours after extraction, the area should be gently brushed with a soft toothbrush. In the meantime, warm salt water gargle can also be used. It is normal for pain to occur on the day of tooth extraction and to have mild pain that can be relieved with painkillers in the days following the extraction, depending on the condition of the extraction. However, severe pain that starts in the days following the extraction, keeps you up at night, does not go away despite painkillers, and feels like a tooth has not been extracted. It indicates that there is an abnormal event at the extraction site, such as infection of the wound site or rupture of the clot. In this case, a dentist should be consulted and the necessary dressing and treatment should be performed. You will immediately feel relief when your doctor makes the necessary dressing for your mouth, gives you antibiotics, painkillers and gargles for oral hygiene. The pain may not stop immediately, but it will ease. If the doctor just prescribes medication and sends you away, it may take 2 to 3 days for your pain to subside. This video is for informational purposes only. We would like to emphasize the importance of consulting with your dentist to determine which treatment is most suitable for you. If you find our videos informative, please do not forget to like and subscribe. Wishing you healthy days.